We're happy to be here today. Again, Brandon Reid with Heartland National. I've had the honor and privilege of working with most of you here on the call for several years already through our hospital indemnity program and Medicare supplement. Today, we have the exciting news of our new Simply Secure Cancer, Heart Attack, and Stroke policy, which we're hoping to go live with in 9 states on August 12th, here just next week, and soon after launching several more states as they come, including Mississippi towards the end of the month and Ohio as well. So today I'll get the chance to discuss who we are as an insurance company, a little bit about myself as well. We'll go over our current product availability, including our other health and annuity products. What is cancer? Our progress as a country against cancer, and of course, diving into our Simply Secure Cancer, Heart Attack, and Stroke policy. We'll go over some contacts here at Heartland National. That way you know who to contact when you are looking to contract with our company, to write business with our company, or to help service your clients, possibly even to learn more about our company. You know, Heartland National Life, founded back in the 1990s, we purchased an insurance company called Dixie National back in 2007. And at that time, we really just started with Medicare supplement business. Our owner was actually the previous owner of Heartland Financial Group. And he had put over $100 million of MedSup premium on the books through his FMO and even through this insurance company here at Heartland National. He then started building, fixed benefit cancer plans, our 1.0 hospital indemnity, leading into our current Secure Advantage Flex hospital indemnity, and of course, more modernized Medicare supplement blocks of business that we've known and sold over the last several years. Just recently, we have expanded into the annuity space. So we have a multi-year guaranteed annuity that's doing really well, performing great for us these last several months. We've got a new home health care policy that's doing really well. And of course, this new cancer, heart attack, and stroke policy with all of these wonderful riders that we're going to dive into today. So as an insurance company, we have over 45,000 trusted policyholders in the senior market. And we just plan on expanding that pretty rapidly over the next several years. We just achieved our first AM Best rating almost exactly a year ago with a B++ rating at the time. We're holding strong at B++ after our 1-year anniversary. And one of the reasons we couldn't get into that A rating category was due to product diversity. At the time, we had a Medicare supplement in 10 states and a hospital indemnity in 36 states. Since then, as I mentioned earlier, we've launched new products, home health care, annuities, and now a cancer, heart attack, and stroke plan. So that should help us get into that next level of ratings, the A category, in the next year or two. In the future, we plan on expanding our growth with annuities, but we're currently in discussion with a lot of FMOs and agency partners out there in the fixed indexed annuity space. So we're looking to build a FIA over the next year and get out there to help serve more and more of your policyholders. It is a final expense product is in the future, but that will be a little bit further down the road. You know, here at Heartland National, we pride ourselves in accessibility, and having access to individuals like myself, Nick Micheletti, our Chief Marketing Officer, Todd Weiss, our VP of Annuity Sales. Agents seem to really like that because each of us is a licensed insurance agent, and we all have experience dealing with clients, right? Policyholders at the policy level. So we know what agents are going through out there in the field and on the phone and running an agency day to day because we've been in that FMO space. We've been in that field agent space. And we take that to heart, and we try to make everything as easy and seamless as possible for you when doing business with Heartland, whether that's getting that initial contract to sell our products, getting logged into your portal and downloading and ordering supplies, writing that first piece of business and filing a claim. Maybe you're an agency just getting started and you need training on some of these ancillary products that we offer. We offer top-notch service and training to your agents and to yourselves. And we're always leveraging technology along the way, right? Nick's slogan is we're always innovating. Nick, our Chief Marketing Officer. Nick has a team of developers just down the hall from me here in the office, who we have access to probably a little bit too frequently, to where if you have any feedback for us in our agent portal, in our e-applications, we just need to simply walk down the hall, run it by our developers, and put it on the schedule. So with that, we've built a lot of in-house technology. We've got e-applications in-house for hospital indemnity, home healthcare, and cancer. We use Firelight for our annuity e-application and CSG for the MedSup. But other than that, everything's in-house. And even though we use some of those other third-party vendors for annuities and MedSup, we still have access through our agent portal to get to those sites. Again, our team has built a lot for you in the portal. We now have claim tracking to where you can track prescription drug reimbursements on home healthcare policies, hospital indemnity claims, home healthcare claims, and you can see those policies getting worked within 14 business days of submission. If you ever have any delays on that side of things, again, our contacts are going to be pulled up on the screen towards the end of the call. You can always reach out to us here at the home office to help reach some of the managers in the claims department to see what might be holding up a claim. Oftentimes, it might be waiting on medical records from a provider on a contestable claim, or perhaps they submitted the wrong type of bill for a prescription drug receipt. Maybe we're missing something like the fill date or the name of the medication to determine generic versus brand name. We have access to this data, and we can share it with you already in the portal and also through our contacts within the company. What's nice about our company is no matter what product, you're going to see a policy number in that portal within 24 hours. Some products within 45 minutes, some instantly. So you'll see an ID, you'll be able to download a copy of ID cards on some of these plans. You'll be able to visually see that policy, whether it's issued or not, or pending due to maybe a license in a certain state. And you'll be able to track things in real time through our portal. Your policy holders are mailed an ID card immediately, and they'll get an issue packet and an ID card in the mail on both hospital indemnity and cancer plans. We have a great contracting team down the hall. Typically, what we see is an agent will fill out their contract in the morning, and they'll have a writing number by that afternoon. That's how quick they turn around contracts, within 24 hours and most of the time, same day. We have great reporting tools as well. If you ever need a book of business or access to anything, we can pull those for you on our end. And again, reach out to us here if you ever need anything at the home office. You'll notice here, especially on this cancer plan, we've got a wonderful opportunity when it comes to top commissions. Big heap first year commissions on this new cancer plan, similar to what you're seeing out there with Aetna, and of course, wonderful bonus opportunities on some of our products as well. So let's get into it. What is cancer, right? Everybody's here today to learn about our new Simply Secure Cancer, Heart Attack, and Stroke policy. So I think it's important we understand a little bit more about cancer. Most of us know cancer is simply a disease characterized by the uncontrolled growth and spread of abnormal cells through the body. And of course, if this is not treated, it can lead to death. The cells expanding through our organs, whether it's the lung tissue or brain, can end up growing and causing those organs to unfortunately not perform properly. 18 million Americans have a history of invasive cancer in 2022, most of whom were diagnosed many years ago and have no current evidence of this disease any longer. Over 2 million of new cancer cases are expected to be diagnosed in 2024, and approximately 611,000 deaths from cancer are expected in 2024. This is about almost 1,700 a day. 1,700 deaths a day due to cancer. Cancer, we know, is the second most common disease behind heart disease. And thankfully, that's why Heartland National here will have the option to add cancer coverage, cancer and heart attack and stroke, or just heart attack and stroke coverage. A very flexible policy to help with both of those two leading causes of death in the United States. So everyone's at risk of developing cancer, of course, and at least 42% of newly diagnosed cancers in the US are potentially avoidable. We are making some progress against cancer, and this chart does a good job showing the trends here in the United States. So the best measure of progress against cancer is the reduction in the likelihood of dying from the disease, referred to as mortality or cancer death rate. And you can see on the right-hand side, you see some of these cancers are decreasing by over 5%, like lung cancer and bronchus cancer. Because less and less people are smoking these days, we're seeing, a lot less cancer diagnoses. We're seeing a large decrease all around on these different types of cancers, and it's really a good sign. There are, again, we mentioned the mortality rate and the death rate decreasing from these cancers. What's unfortunate about that is individuals are experiencing multiple cancer diagnoses in their lifetime. So they're not just being diagnosed with cancer one time, but again, several years later, being diagnosed again. And that's where some of these benefits we've built into our cancer policy are really going to come in clutch for our clients, because we've taken the time to look at these statistics and make sure that we've got some options built into this plan to protect people from recurring diagnosis of cancer. These costs associated with cancer are absolutely enormous. We have an estimated $21 billion of cancer-related costs to patients, including $16.2 billion in total out-of-pocket costs and $4.9 billion related to patient time and travel and time in treatment or waiting to receive care and in receiving care. So these include loss of wages as well. When somebody's diagnosed with cancer, not only are they paying huge medical bills, right? Co-pays, co-insurances, deductibles, but they're also having to pay for getting to those appointments. If they have to travel to the Mayo Clinic in Rochester, Minnesota, or Florida, Cleveland Clinic up in Ohio, we have to take that into consideration. Costs that aren't covered by Medicare, right? Experimental treatment like experimental stem cell transplants, drugs that aren't covered by Medicare. I had a perfect example a couple of years ago, a lady who was on an employer group health plan with Blue Cross Blue Shield. Her and her husband were looking to get on Medicare. And this cancer medication she just found out about was going to cost $21,000 on Medicare. So if she would have got on Medicare, she would have been out of pocket $21,000. There were no types of subsidies or assistance for that individual when it came to these costs for that prescription on Medicare. I had to recommend she stayed on her employer group health plan a bit longer as she went through her cancer treatment, because that medication was covered by the employer plan, and there were subsidies out there for her not being on Medicare. Of course, I mentioned loss of income. When somebody's diagnosed with cancer, they're unable to work, and sometimes those treatment plans can last several years, right? Multiple years, several months, multiple years. So 40% of men and women will be diagnosed with cancer at some point in their lifetime, and the statistics are even higher for individuals between 65 and 85. So as we go through this product, we'll touch on the base plan, the option for just cancer, like I said earlier, the option for heart attack and stroke only, or both. This product is issue ages 18 to 90, with benefits ranging from $5,000 to $75,000 in $1,000 increments. So I know a lot of agents on today's call are used to these programs with some of the other companies. You should see a lot more flexibility with Heartland here in terms of increasing by $1,000 increments here on the base plan. This policy will be guaranteed renewable for life as long as the insured continues to pay premiums. You'll notice as we go through this product, we've got several optional riders. If you're purchasing a base cancer policy, you can add heart attack and stroke. We've got a cancer benefit builder, that you can add to the policy, a heart attack and stroke benefit builder that you can add to the policy, radiation and chemo treatment, critical illness, return of premium upon death, or return of premium after 20 years. Also built into this policy will be a recurrence benefit that I'll expand on some more here in just a moment. So this policy, what's nice about it is, again, the rate locks in at issue age, and we base the rates off of the youngest spouse. Okay, you'll want to make sure that when you're applying a husband and wife for coverage or a family for coverage, you're entering the youngest spouse in the house as the primary applicant. That way you lock in that rate. If the husband's 35 and the wife is 27, enter the 27-year-old as the primary applicant. As long as they can pass health questions and underwriting, you want to make sure they're the primary. That way the wife, the husband, the children, they're all paying the 27-year-old rate rather than the higher 35-year-old rate on the policy. What's nice is I know you see higher rates with some companies due to tobacco use. We will not charge tobacco rates. We have coverage for individuals, individual and spouse, individual and children, a family, or even a family with one spouse. So quite a lot of options here, and we will add dependents on this policy under the age of 18 up until they're 26. Once they're 26, they have the option to continue coverage, but take over on those premiums. We'll accept monthly, quarterly, semi-annual, or annual bank draft. And we have a direct bill option for quarterly, semi-annual, and annual. So we're currently approved and ready to go on August 12th in 9 states. Okay, I know a lot of folks on this call are ready for Mississippi. Mississippi was just approved yesterday, and we plan on getting that up and running in our system and e-application along with Ohio just in a matter of a couple weeks, 2 to 3 weeks. So stay tuned. This map is going to be getting updated rapidly and consistently, frequently over the next several months. We'll see new states being added every couple of weeks. So as we continue to grow this product into Florida, North Carolina, South Carolina, Alabama, just stick with us, and we're excited about even Texas as well. We're going to have this product approved in a lot of states leading up to October for this AEP. Like I said earlier, you do have the chance to choose one or the other or both on this policy. Built into this policy, not only do we pay 100% on internal cancer, but we'll pay a 50% benefit on non-invasive cancers, cancer in situ, stage 0 non-invasive cancer, and a 5% benefit on skin cancer. The skin cancer benefit can pay once per year up to 3 times in a lifetime. And built into this policy, we have a restoration of benefits. This goes alongside both the cancer benefit and the heart attack and stroke policy. The heart attack and stroke policy paying 100% for heart attacks, 100% for heart transplants and stroke, a 25% benefit for heart valve replacements and repairs, aortic surgeries, coronary artery bypass, and even smaller 10% benefits for angioplasty and stents. So the insurance company is rewarding preventative services like having a stent placed to prevent that big heart attack from taking place down the road. A heart valve replacement, again, trying to help with prevention of stroke and heart attacks. If you are diagnosed down the road with a severe incident like a heart attack or heart transplant, we'll pay the 100% benefit still. The recurrence benefit is built into this policy, and this is a big one because most companies charge an additional premium for something like this. If you're used to selling another company's cancer, heart attack, and stroke plan, you'll see an additional premium of $7, $8, $10 or more a month to add a benefit like this to a policy. Our benefit gradually restores over the course of 5 years. And after 5 years of remission or 5 years cancer-free from an initial diagnosis, this policy can pay out again at 100%. Okay. With other companies, you'll notice, yes, you're paying an additional premium for this, and it takes 10 years for a benefit like that to restore back up to 100%. So not only is this built in for no additional premium, but our rates are going to look just like our competitors with this built-in recurrence benefit. Okay, when you start adding this type of benefit on with other competitors, the rates are going to be much higher. And it's going to take longer to restore. My favorite rider, well, I'm probably between the benefit builder and return of premium, but I would say this is my favorite rider. This benefit builder here allows your policyholder to add $500, $1,000, or $1,500 to the base of their policy for every year they go cancer-free. Meaning if my client Sue purchases, or let's use Sherry here down below as an example. If Sherry purchased a $20,000 simply secure payout at the age of 40, and she purchased a $1,000 benefit builder. After 20 years cancer-free, Sherry gets diagnosed at the age of 60 with cancer. Her benefit will increase from $20,000 to $40,000 after the course of 20 years, and she would receive a $40,000 payout. Okay, the cost of this rider, the premiums for this rider are quite affordable, so make sure to check that out. Again, we're going up to 35 years cancer-free. So if you have a $1,000 option and you go 35 years cancer-free, that adds an additional $35,000 to the face amount of your cancer plan or your heart attack and stroke policy. We also have a critical illness rider, which will pay up to your base policy. So if you have a $10,000 cancer plan, you can go up to $10,000 in critical illness. If you have a $50,000 critical illness or cancer plan or heart attack and stroke plan, we can go up to $50,000 in critical illness. This benefit does max out at $50,000, whereas the base policies, heart attack and stroke rider or standalone heart attack and stroke and cancer, go up to $75,000. So pay lump sum benefits for Alzheimer's and dementia, ALS, MS, blindness, coma, ESRD, which is a big one, I think, in the Medicare space, loss of hearing, loss of speech, major organ transplants, paralysis, and severe burns. I think the biggest ones here for me, looking back at, over the years, are Alzheimer's, dementia, and end-stage renal failure. Like I said earlier, we have two options on this return of premium rider. We have a return of premium once your policy has been kept in force for 20 years, so a 20-year option, and a return of premium at death also available. You may have seen a similar rider with some of our competitors here on radiation and chemotherapy. This is a monthly, weekly, or daily benefit depending on the type of treatment. Immunotherapy paying at 3 different levels: an essential, enhanced, or comprehensive option, going up to $800 a month for immunotherapy. Injected chemo pays weekly. Non-hormonal therapy paying monthly up to $800. Hormonal oral chemo paying monthly. Anti-nausea drugs paying monthly. Radiation treatment paying weekly up to $1,800 per week. $1,600 per week. That's a huge benefit. And experimental treatment paying at up to $200 per day. Right? This is a big one for certain things. Experimental treatment not covered by Medicare. So what I'd like to do is give everybody some contact information here, and then we're going to jump into our agent portal and take a look at the e-app. We are still currently going through testing in our dev environment. So our developers are working hard on making it look pretty and working seamlessly for everybody. I want to take some feedback off today's call and go back to them so that everybody on today's call can have some involvement in building this e-application. So again, we'll take a look at our agent portal. I want to make sure we open it up for some questions here too at the end, Jackson. But first, let's take a quick demo through the e-application, and maybe we can start throwing some questions in the chat box. I'll certainly open this up to everybody. I'll get everybody copies of the slides here. Jackson, I can send those over to you and you can share them with everybody who attended. I just threw that website to our agent portal in the chat box for you. If you've already got a contract with us on the health side for hospital indemnity and home health care, the cancer plan will just be added to it, and we'll make sure to get those updated commission addendums out to everybody to review your new commissions. So again, to access our portal, the website www.hnlicagent.com. When you first contracted, you would have used a generic username of your creation to log in and complete that contracting. Once your contract was approved, you were assigned a writing number. That writing number is now your username. Okay? Log in with whatever password you created for the portal here during your contracting process. And then yes, Jason, we are launching this cancer, heart attack, and stroke policy in the portal August 12th in 9 states. And we'll be adding quite a few more here towards the end of the month and into the next several months. Anybody familiar with our portal already knows you can access any of our e-applications or quoting softwares on the right-hand side of your screen under quick links. Along with that, our supplies tab over here on the left-hand side for downloading brochures, ordering app packets, paper hard copies of our brochures, underwriting guides, and more. You'll see our cancer, heart attack, and stroke e-app towards the bottom. And you'll have the ability now to save and continue, come back to applications at a later date and time to finish those up. If you've had issues getting them signed, you can come back in here and resend those now yourself. We'll do a quick quote here again. Make sure this is where you're entering that insured's birthday. If you are doing a family or an individual and spouse, make sure you're entering the lower of the two's birthday in terms of the spouses. So if I'm born in 1954 and my wife is born in 1959, we'll want to make sure we enter the individual turning 65 here in September, the lower of the two. So you can see it's only going to show access to the companies that we're going live with on August 12th to start. Okay, so that we don't confuse you. And again, if anybody joined later, we're adding Mississippi and Ohio here pretty soon. Within a couple of weeks, we should have that taken care of. And you'll have the choice between a cancer-based plan or a heart attack and stroke-based plan going up to $75,000. Now, it's not to say you can't add the other. You'll just add that through our heart attack and stroke rider, or vice versa if you start with the heart-based plan through the cancer rider, which would still go up to the $75,000. So we'll start with a cancer-based policy of $10,000. And then maybe we want to take a look at this return of premium rider after 20 years. I did some math earlier today, and I'll do it with you here over the call. I think that return of premium rider should lead to a lot of success out there in the field, positioning this and closing a lot more of this type of insurance. With this return of premium rider, you'll see the rates are pretty competitive at $11.70 for a 20-year return of premium on a 65-year-old. Adding that to a $10,000 base policy would bring the individual's total monthly premium up to $37.70 a month. Times 12, $452.40 for the year, right? That over the course of 20 years is $9,048. We've purchased a $10,000 benefit here. We come out up about $1,000 if we don't experience a cancer diagnosis over the 20 years. So very competitive rates on that return of premium rider. and the numbers do make sense, which is nice. Some other simple math I like to do is take that monthly premium times 12, right? Convert that into an annual premium, and take that, divide it into their total benefit amount. So if you have a $10,000 benefit, you'll divide that by $26 times 12, should be $312. So you'll take your $10,000 total face amount of your policy and divide that into the annual premium. You'll show your client that it'll take over 32 years to pay more into this policy than you would receive in a lump sum benefit. Okay, it'll take over 32 years to pay more in premium than you receive from that $10,000 payout. So if I'm helping a 65-year-old here, right, they're going to be, what do we say, 32 years, they're going to be 87 years old by the time they've paid more into this policy and premiums. Again, most cancer diagnoses are coming before the age of 85. So we have a pretty nice looking e-application here. Very simple underwriting. Whether you're applying for just cancer or heart attack and stroke only, you'll see it's very limited health questions, right? So again, this is being recorded, so you can come back to it later. I know we're not going live until August 12th, but at that time, we'll make sure that all of these health questions are uploaded into our supplies tab via the paper app. And again, you'll have access to the e-app and quoting software then as well. So it's a 5-year look back for cancer, not 10 years, 5 years to purchase this cancer rider. We also ask about things like AIDS and HIV, right? We want to make sure that in the last couple of years, they haven't seen a medical professional for any tests or monitoring related to cancer, like PSA screenings with abnormal results, mammograms, colonoscopies, right, with abnormal results. We need to make sure that everything is conclusive and there is no doubt about that individual getting any results soon about a cancer diagnosis from recent testing or scans. So 4 health questions. And again, if you have any feedback on the e-application, go ahead and throw it in the chat box. We will come off mute here in a second with Jackson and open it up for some questions. So email is not a required field. For the sake of time, we'll go ahead and skip that. So that'll be automatically selected. If your mailing address is the same as your residential, you just simply choose yes. It's already selected there as being the same. When entering a beneficiary here for the applicant, again, you may have an individual or you may have an individual spouse or family applying. You want to select beneficiaries for those individuals. And make sure that those percentage of benefits for contingent beneficiaries and primary beneficiaries total up to 100. Okay, if they have Medicaid, it's not going to knock them out from applying for coverage, but we still ask just for our records in case anything comes up down the road. You can purchase cancer coverage if you're on Medicaid, although they are cost share protected by the states. Not necessarily.
I'll answer some of them. Jacob Purdue says, when you said the return of premium is 20 years. All right. What about, well, so we have some specific state questions. The grayed out states are typically states that Heartland National it doesn't have a product in at all right now, correct?
Right, we're licensed in 36 states.
Okay.
As a company.
So Texas will probably be soon. I know Jason Fisher was asking. Scott, unfortunately, on Wisconsin, it's probably not going to be a thing there right now.
For a little
but
while.
you can-
Yeah, we're working on Michigan and Wisconsin over the next year or two, but nothing 100%.
Okay. Okay. My dial here is going crazy. All right. I emailed Sam for a contract. Okay. Well, Eddie says he's mortified. It's okay. I didn't even get to see it, Eddie. I'm actually a little upset. I should have, before I read it, I should have went and looked, man. You're good. Don't worry about it. Better you than me, brother. No, awesome. So, well, thank you, Brandon. We really appreciate it.
Things. There's no AFB on this product. Again, for those of you who joined later, we're going to go off the lowest age to determine the rate. So if you have a 68-year-old and a 64-year-old, we'll go off that 64-year-old rate for all the policyholders.
Awesome. Sweet. Yeah, guys, obviously this product having the recurrence benefit priced into it and being priced so competitively, and then, you know, you still allowing the price for the younger spouse for a husband and wife combo, and the unisex and tobacco rating not being a factor, makes it extremely competitive. The commission's also extremely competitive. If you guys want to learn about that, you can reach out to our team. If you already have Heartland National, I believe you're going to automatically get this product. You're not going to have to go and sign anything. It looks like it's just going to be added to your contract. And yeah, any additional questions that come up, just reach out to our contracting team, contracting@BobbyRockInsurance.com. We appreciate you guys. Yeah, the benefit